Hello, everyone, and thank you for joining us for the second in a series of events hosted by the Duke Immigrant and Refugee Project and the Immigrant Rights Clinic, focused on contemporary immigration issues. My name is Shane Ellison, and I'm a senior lecturing fellow in the Immigrant Rights Clinic. I'm delighted by all of you who have joined us for what promises to be a very interesting and timely discussion in regards to the outsized impact COVID has had on immigrant and refugee communities, both here in North Carolina as well as across the country. The Washington Post reported yesterday that the United States just topped 7 million coronavirus cases, and only last week we passed the grave milestone of more than 200,000 deaths. Yet the effects of COVID have not been evenly distributed. Immigrant communities continue to suffer disproportionately to that of the general population. In addition to experiencing higher rates of infection from the virus, the economic instability caused by COVID, such as unemployment, threat of eviction, and food insecurity, has also fallen disproportionately to the immigrant community. This community faces unique hurdles in accessing COVID-19 related services and remaining safe in their workplaces. And they understandably are fearful about how getting tested or treated for the virus might impact their immigration status. On top of all of this, immigration detention facilities continue to experience higher levels of COVID infection than the general population, yet non-citizens are still being detained and deported from those facilities to other countries. Here to explore with us these issues and what can be done to combat the impact of COVID on immigrant communities are Sirine Shebaya and Eliazar Posada. Sirine Shebaya currently serves as Executive Director at the National Immigration Project of the National Lawyers Guild. Before joining NLG, she worked with various nonprofits, supervising immigrant rights litigation and advocacy. Shebaya initiated and directed the Immigrant Rights Project for the ACLU of Maryland, where she helped end local collaboration with ICE. She also is one of the founding organizers of the Dulles Justice Coalition, a group of lawyers and volunteers created to assist travelers to Dulles Airport affected by the Muslim ban. Additionally, we have Eliazar Posada, who currently serves as Director of Community Engagement and Advocacy at El Centro Hispano. Posada began working at El Centro Hispano in 2015 as the Hola Latino Coordinator, where he advocated for LGBTQ inclusion in Latinx communities and created a program for HIV/STD prevention. El Centro Hispano is a Latino nonprofit organization dedicated to advocating for equity and inclusion for Latinos in the Triangle area. Thank you both so much for being with us today. Sirine, can you get us started by talking about what you and the National Immigration Project are doing in this space, particularly as it relates to the spread of COVID in detention facilities?
Issues at the intersection of criminal and immigration matters. We do a lot of crim work, and we also do a lot of enforcement and detention litigation and work. And it's through that lens that we sort of have come into contact the most with the very devastating impact that the COVID-19 pandemic has had on immigrant communities. I mean, I think that the outsized effects of the pandemic extend far beyond the walls of, the immigration incarceration system. I think that immigrant communities and communities of color have been very hard hit by the pandemic in ways that perhaps Eliazar or others can sort of speak to more fully. But I'm just going to focus on a slice of it, which is perhaps one of the most horrible things that you can do to someone during a pandemic, where you're being told that you have to stay 6 feet away from people and cover your face at all times and use hand sanitizer and not touch things that other people have touched. One of the worst places that you could possibly condemn someone to be is in large overcrowded facilities that hold thousands of people, who are all put together, who have zero control over whether they can even get something as basic as soap or hand sanitizer, and who have zero control over their sleeping arrangements, their living arrangements, what the day rooms look like. And I'm starting there because I think that actually the lived experiences of immigrants in detention are some of the most sort of hidden from view, and also just devastating ways that this virus has, kind of spread and impacted immigrant communities. But it also shines a light on the kind of bloated system of mass incarceration that we have in our immigration system generally, even before the COVID pandemic hit. We represented people. So we started doing kind of in close coordination with both community organizers and also the local legal service providers, we decided to bring litigation trying to obtain release for people, especially people with medical vulnerabilities who were detained at the beginning of the COVID pandemic. And so we filed litigation in Maryland, Virginia, Louisiana, Mississippi, Alabama, Colorado, and California. And we also filed litigation in DC that was like slightly different, that was more targeted at the fact that detained hearings were continuing and people were being put in waiting rooms of courts, like sitting side by side with dozens of other people. And you know, they're just like, were, shall I say, cascading effects of the incarceration and detention of immigrants in sort of throughout the entire immigration system. And the reports that we heard back from people who are detained at those facilities is that they are continuing, even when ICE was publicly saying that people are socially distancing and they're taking all the measures to, you know, put in place recommendations about how you prevent the virus, that people were still in overcrowded locations, that they could never stay 6 feet away from other people. In Farmville, people described a situation, and we actually found photos that kind of corroborate this, of being in bunk beds that are sort of like catty corner, like, you know, you have 4 bunk beds, 2 and 2, and people were saying we were sleeping shoulder to shoulder through this entire time. And in facility after facility, after they would sort of feel very proud of themselves about how great they are because they gave people a cloth mask 6 weeks into the pandemic, we would then start seeing like the first case, the second case, until eventually there was like a massive outbreak at the facility. And this happened in several of the places where we were litigating. There were a few places where we were able to obtain release. We actually, most notably, I think, were able to win a case in Louisiana in one of the, you know, in a very kind of conservative judicial district, where the judge saw that this is really a disaster in the making, and ordered the release of several people who had medical vulnerabilities that made them especially susceptible to serious illness or death from COVID-19. Unfortunately, the success was not universal. And so in Virginia, the judge saw fit to deny our motion not to release people. And then 2 months after that, or not even 2 months, just, you know, I think it was 2 months after he denied the petition, there was a massive outbreak at Farmville. People were passing out in the dorms from COVID-19. They were not testing. They took their time. They weren't giving people medical treatment. And then eventually, when they started testing, it became known that like there were 339 cases of COVID-19 out of a facility that had 360 people total, or 370. So like essentially everybody in the facility ended up getting COVID. And one person unfortunately died, and that was an entirely preventable death. It was a Canadian man who was over the age of 70, so in a particularly high risk category for COVID-19. And instead of just, you know, sending him to Canada, which is where he was trying to get, they chose to detain him for weeks and weeks and kind of delay his flights and expose him to this harm. I'll stop there. I mean, this is sort of a story that we've seen over and over again in many different facilities. Actually, I will say one thing before I stop. Our fight initially was to try to get as many people as released as possible. In places where we lost that fight, we sort of shifted to trying to shine a light on the conditions. And so we've gotten things like site inspections ordered. We've done, you know, requests for conditions reforms. We got an order in Virginia from a different judge stopping all transfers into the facility, which was a huge thing because ICE was continuing to transfer people back and forth between facilities like there was no tomorrow, in the middle of a pandemic when the CDC had said transfers should happen only when absolutely necessary. So the fight, I think, has shifted from the immediate release kinds of requests to more like site inspection and monitoring and shining a light on conditions that may eventually lead to some releases, at least on the litigation fronts. So I'll stop there and see if anyone has questions.
Great. Yeah, and actually I would just remind folks or let folks know that you can submit questions via the chat function. And so Professor Evans and I will be keeping an eye on those questions, so do feel free to submit questions. So far, I don't have any on the chat, but I wondered, Sirine, if you might be able to say a few words about, you know, what you think the factors are for where the litigation was successful and maybe it wasn't. Maybe it's just, oops, my lights turned off. Sorry. Maybe it was just having a favorable jurisdiction versus an unfavorable jurisdiction, but what would you see as some of the factors to make litigation in this area, more likely to succeed?
Yeah, I think that's a very good question. And it's actually interesting in that the results did not align very closely with what you would expect in terms of success, although they did in Alabama, but I mean, in other places, they didn't align exactly with where you would expect successes and failures to come. I think that one of the critical factors was where there was early massive explosion of COVID-19 in a way that sort of shocked people's feeling that all was normal. And so, we saw like, I think some of the earliest cases were one that the ACLU filed in Washington, and very shortly thereafter, we filed one in Maryland. And then the Bronx defenders and the Brooklyn defenders and Legal Aid of New York filed like a series of cases in New York. And the Washington case was unsuccessful. The TRO was denied. But then the New York cases started to like one after another kind of cascade and win release for people. And I think the reason was that in those first sort of weeks of the pandemic, New York was extremely hard hit. And like people, the numbers were crazy. People were really shaken to the core by just the sort of massive dangerousness of that disease. And I think that actually had a real impact on the way that judges looked at this and their sort of recognition that this is a really exceptional situation. We had an early win, or not really that early actually, was I guess in April in Louisiana, where we weren't really expecting it as much. That I think also is based on how bad things were getting in that state at that time. So I think that it tracked a little bit more closely to where the pandemic was really hitting hard, so that people were shaken out of their routine, like, oh, it's just another habeas petition from immigrants. The same thing happened in Pennsylvania, where a fairly conservative judge actually released people because of that, I think. And then in Maryland, initially, we didn't win release. We got a TRO order that was really excellent in terms of its analysis of the law, but the judge found that because there were no COVID cases in those two facilities that we were fighting over, that it was that it hadn't risen to a level where release was necessary. But then we sort of developed other facts and we filed again for a TRO, and then he released people from both facilities sort of a month or so after that. So I think it's sort of it's like both, one of the factors I think is how the prison administration responds. That's always a factor in the analysis, because fundamentally the claim is that there is some kind of fault on the part of the prison administrators. I mean, we've argued that that shouldn't be the standard, that it should be an objective standard about reasonable safety and whether there's something that kind of can be characterized as unlawful punishment. But I think a lot of courts analyze this in terms of whether there's deliberate indifference on the part of the prison administrators. So that makes a difference. And I think how you analyze that happens against the backdrop of what the surrounding situation is, right? Like how bad is the outbreak where this particular lawsuit is happening? And then also whether there's an outbreak at the facility itself, like what are the conditions like there? I think the judges ended up all being very sort of fact specific in their analysis, looking at this particular facility and, the numbers and the testing regimens and things like that.
That's very fascinating. In terms of maybe thinking about kind of the conditions of ICE detention even before COVID, I mean, can you say a word or two about the availability of medical services and kind of general medical treatment, even in pre-COVID times? Did ICE have its act together then and it's just failed to do so now?
Absolutely not. I mean, I think one of the things that the COVID pandemic has really highlighted was just how deficient pre-existing medical care was at those facilities. And I mean, organizers and advocates on the ground had been sort of saying that for a very long time, right? Like La Resistencia in Washington State and La Colectiva in Virginia and Sanctuary DMV. And I think there were sort of community organizations and people who are working closely with those who are detained who have been saying for years that the medical care system in ICE facilities is simply inadequate at a number of levels. And I think one of the things that I will note is that it became very clear that like the system for requesting a sick call, for example, in most facilities is utterly inadequate, because if you're suffering from COVID symptoms, you need to be seen immediately, right? But like there were I think across facilities, we got reports that people had to wait 3 or 4 days to be seen. People were going to medical in groups, like to get their, for example, like treatment for diabetes or conditions that make you especially vulnerable to serious consequences from COVID. None of the ICE facilities we worked in, not a single one, was taking any special precautionary measures for people who are medically vulnerable. They were just doing the same things for them as for everyone else, which was frankly very little. And of course, we are all, I think, aware of the really shocking allegations that have come out of Georgia, where non-consensual medical procedures were being conducted on people, and unnecessary non-consensual, and like, I think it's easy to say, well, that was one doctor who was just like, profit focused and doing something. But the thing is that if the system wasn't such that it deprived people of ownership of their bodies and the ability to really consent to what's happening to them, the ability to understand why they're being subjected to certain medical procedures, like that is inherent to the system. It's not something that's specific to one person. It's something that exists across the board in immigration detention. And I think that, the COVID pandemic has really highlighted that.
Yeah. Given that folks who are detained here in North Carolina do end up, getting transferred to either Stewart or Irwin, and you've said, a word or two about Irwin. I mean, how are things in Stewart, if you know? What are conditions like there?
I'm not as familiar directly with Stewart, but I think that Project South, which has been putting out sort of a lot of materials about both facilities, has some materials that, people who are interested could potentially look at to sort of find out a little bit more. My understanding is that things were pretty bad at Stewart at the beginning of the pandemic also, and there was some litigation around that. We weren't personally, NIP was not involved in that litigation, but I think some other groups like SPLC and et cetera filed suit there. So yeah, I would also say that the vast majority of immigrants in the United States who are detained are placed in places that are really far and hard to reach and that are not in good judicial districts. And that's not an accident, right? Like the thousands of people who are held in places like Alabama and Georgia and Mississippi and Texas and, the far ends of the earth where attorneys have to drive for 6 hours to get to their clients. And so it's a desert of representation, and it's a desert of poor treatment, and just like, so it's so difficult to shine a light on what's going on. And if there's one thing that the COVID pandemic has done, I think it has shown exactly how horrifying conditions at those detention centers are, not just during COVID, but universally.
Yeah. We just had a good question come in. Are there any legal restrictions in the ability of ICE to deport immigrants who are sick with COVID? So how is this affecting the pandemics in other countries folks are getting into?
Yeah, this was actually one of the most horrifying aspects. I'm saying this without exaggeration. ICE single-handedly has been a super spreader of COVID-19, both within the United States and externally. They were some of the slowest people to adopt testing, right? They would refuse to test. They had people with symptoms walking around in their facilities. They intentionally were not testing to not show the extent of the spread in their facilities. And they would put people on deportation flights, asserting that they didn't have symptoms. And then on the other end, people would get tested. There was one well-reported incident where 75% of a flight to Guatemala turned out to be COVID positive, and they caught it on the other end. There was another situation where one of our clients was flown around to 9 different locations in the United States, even though he had already told them that he is medically vulnerable, both because of his age and because of pre-existing lung conditions. And he was infected with COVID as a result. And they were taking zero precautions when they were flying him all around the country. And then the most shocking incident that we've been involved with is where ICE put 74 people on flights from Arizona, a facility that had COVID-19 cases, Florida, another facility that had COVID-19 cases, put them on a flight, did not test them before putting them on the flight, and flew them to DC, to Virginia, to Farmville, and didn't quarantine them appropriately, put them in the facility. And, within a couple of weeks, everyone at the facility had COVID. So that's just like one of the ways, both internally within the US through movement of people without any kind of, like with complete indifference to their health and safety, and movements outside the United States. It's been repeatedly happening that people at the other end of deportation flights are found to be positive for COVID-19. Unfortunately, I don't think there's any legal restrictions on ICE to not deport people who are infected. I think it's arguably unlawful, but like this hasn't been tested, and there's nothing that specifically says that they can't deport people who are COVID positive. And I think it's still the case that they're not universally testing people before putting them on flights.
We just got another excellent question, and it kind of reminds me of some of my own interactions with ICE. I've had clients who became ill in ICE custody. This was in pre-COVID times, who required very serious treatment, and ICE would release them so they weren't responsible for providing any of that treatment. And so the question is, what are the conditions for them releasing people? And are they kind of doing any follow-up if people got sick in detention and were released? And sort of related to that is, how's that impacting their numbers? Is ICE thinking about release in this sense in terms of their COVID numbers? So kind of a lot, like a bucket of questions there together.
Yeah, absolutely. I think both release and deportation, they're thinking of this way because it sort of decreases. I mean, for example, the number of reported deaths from COVID-19 complications in ICE detention is 8. I think, as of last count, but I think that that's a massive undercount because, many more people have died in ICE custody since that time. And it's unclear whether COVID was a contributing cause or wasn't, or how it was characterized. I think they only report as COVID deaths the numbers that, have a confirmed COVID positive test. I would also say that there have been at least a few people, and I'm sure many more that we're not aware of, who died shortly after being released from ICE custody, who contracted COVID-19 while in ICE custody. So there's that piece to also consider. And yes, I mean, I think it's not new that ICE does this, where someone gets so sick and they just release them so that they don't have to pay for their medical care. And I'm sure that that's happened with some degree of frequency during the COVID pandemic as well.
Mm-hmm. In terms of thinking about like release, obviously that's one of the things that many of these lawsuits are being brought, right, to get people out of these dangerous conditions. But you talked about kind of another focus of the litigation, trying to kind of put in place other mitigating strategies to help prevent the spread of COVID. How is ICE responding? Are you seeing them implement any changes and improvements, or are they kind of doubling down on the things that they've done before?
Well, whenever a court orders an inspection, we see a flurry of activity where they suddenly like start putting people in every other bunk and like putting tape on chairs and things so that it doesn't look like people are sitting very close together. Before an inspection that we had in Maryland, the people detained there were reporting to us that they were suddenly putting signs everywhere showing people how to wear masks and wash their hands, and like, suddenly supplying cleaning supplies in a way that they never had before. So I do think that this accountability and monitoring mechanism is very important, because even when you don't obtain release, at least you get people on their best behavior as far as the things that are possible to do. I mean, we've argued many times, and I think public health experts have said many times, that especially for people who are medically vulnerable, there's simply nothing you can do to really protect them from COVID-19 in detention because of the nature of the congregate setting. But there are things you can do to sort of mitigate and make it less likely that they will all contract COVID-19, like significantly reduce the population, try to, have social distancing, enforce mask wearing, and assign staff to only one dorm rather than having them shuttling back and forth between different dorms and things like that. And some of these things we have seen courts order. We have seen as a result of sort of inspection reports that some of these really the worst of the practices were changed a little bit.
Very good. Maybe in the last few minutes of the time that we have with you, because I know you have to go one, what would you say to law students who are interested in this issue, they've been moved by this, they want to get involved, they want to help? What can they do?
I think that you can look and see in your area who's working with detained populations, who are the community groups who are on the ground. I think frequently one of the sort of most unresourced groups of people are like organizers and community groups who are working directly with detained people who might need, your law student support on, let's say, writing reports or doing FOIA requests or researching certain things or amplifying advocacy that they're trying to do. I think that that is one immediate way that you can really contribute, is just like ask the people who are working directly with folks in your community who are impacted and see how you can use the skills and resources that you have at your disposal to actually make a difference in the work that they're doing and sort of help amplify and support it. I know we use law students a lot for clinical projects and things like that on a range of issues impacting immigrants. And I think organizations are always looking for, you know, smart young people who want to make a difference. So that would be you.
Excellent. Well, again, we thank you so much for your time, Sirine. It's been a real pleasure to chat with you. And we wish you a lot of luck in your fight for justice on this issue.
Thank you so much. And apologies again for having to leave early.
Not at all.
Bye, everyone.
Bye, Sirine. So kind of shifting gears then and moving over to you, Eliazar. You know, Sirine has kind of given us a bit of a picture about what the kind of litigation and action taking place on a national level in the fight against COVID in detention. Can you tell us a little bit more about your work with El Centro and your response to kind of the challenges that you're seeing COVID pose here to North Carolina immigrant communities?
Yeah, so first of all, thank you for inviting me for this conversation. It's already been an awesome one. So El Centro Hispano, for one, we're the largest Latinx-led, Latinx-serving nonprofit in North Carolina, and we have a multitude of services. We have 4 priority areas, which is health and well-being, which has been like our leading intervention right now. We have economic development, education, and then my department, which is the Community Engagement and Advocacy department. And I oversee the immigration legal services. I oversee the LGBT programs, the community outreach work, the youth leadership programs. Right now, kind of like our initiatives around census and election, and you know, really engaging folks in everything that's going on. And from the very beginning, right, El Centro realized that we have some great professionals in our health and well-being department that saw this as the threat that it was going to be. And we immediately knew that our community members were going to be affected, not just directly because of COVID, but indirectly because of, you know, kind of the impacts, the economic impacts that are going to come down, right? And as we saw the orders coming through, and as we saw the trajectory of the pandemic, we knew, and we started seeing this, that, you know, Latinx and other folks of color were not only, you know, the most impacted by COVID, right? Knowing that, for example, at one point, the Latinx community made up about 45% of the COVID-19 cases, when making about 10% or 9% of the North Carolina population. That's astronomical, right? That's extraordinarily disproportionate. But that also meant that a lot of our workers were the first ones gone. When the pandemic closed several businesses, and that started going into the lockdown or the shutdown that we saw in the state, the first people that were gone and were a lot of the frontline workers who weren't able to take their work home with them, right? You know, we saw a lot of restaurants closing, a lot of people in the hospitality industry who were the first ones to lose the job, which then that means that, you know, not only do they have to ensure that their family is safe from COVID, now how do you feed your family? How do you pay for rent? And that's when we started really the initiatives to respond to the Latinx community here in the state. And we did, at the very beginning, we did 2 things. First, we have a mobile health unit that goes to North and South Carolina to provide rural health assessments and education to Hispanic and Latinx folks around you know, health and where to get not just health insurance, but also like some health services. So we partnered with a clinic that primarily services the Hispanic and Latinx community to be able to provide testing, right? This is back in March when we first saw this. We were the first organization of our kind to do this, you know, mobile outreach, and we put it in front of one of the more popular Latino shopping centers here in Raleigh. And since then, we've been able to provide almost 1,091 services through the mobile health unit, and then 79 free COVID-19 tests. And that's not including some of the other work we're doing with some of our partners to go out in the communities and do COVID-19 testing. But we also started from the very beginning the COVID-19 response fund, emergency response fund. We knew that people were going to need help buying food. We knew people were going to need help, paying for rent and utilities. And that was where we started off. Today, fast forward, right? I believe it was March 13th when we started the fund. Fast forward to today, we are going out in the community providing personal protective equipment, where a lot of our funds for rental assistance have faded, right? Because at some point there's only so much you can give out. But we're still responding calls every single day. We are going out and giving COVID-19 information to our community. One of the things that we created was a culturally competent message and campaign and social media campaign that's reached hundreds of thousands of Latinos, not just here in North Carolina, but across the South in the US, basically outlining everything that we need to know about COVID, but not just putting a form in Google Translate or whatever, but like really going into graphics that our community can respond to, people can understand, and providing the information that we need. And it's been a lot of work, right? We've given out over 25,000 masks to community members, and we still have another 160,000 that we received not too long ago that we're going to be going out into the community and giving those out. We've given out more than $200,000 in aid and rental and utilities assistance. We've given out I think it's like 25,000, a little bit more than 25,000 boxes of food for community members. That's like outside of the fund. So we're trying to do our best to respond to this, but the need continues to grow. And the more we see, thankfully, the numbers in the Latinx community have gone down as far as infection percentages. But the more we see this pandemic coming up, and now with the threat of a second wave, the more we're seeing the need for community members. So, I mean, that's just a brief overview of kind of like what we're doing.
Well, thank you for that, and thank you for your work. I wondered if you might say a few more words. You mentioned the startling statistic at the start that in the Latinx community, 45% of cases were members of the Latinx community, even though as a percentage of the overall population, less than 9%. What do you think are some of the reasons contributing to that disparity and impact on the Latino community?
So for one, there was a lot of misinformation out there, right? From the very beginning, a lot of the information wasn't put out first in Spanish, which is a lot of the primary language of a lot of our community members. But then it wasn't put out when it was in Spanish, it wasn't really in a culturally competent way. And it wasn't until a couple of months ago that we made a partnership with the state to basically, provide some of that, some of that information in a culturally competent way. So that was number one. Number two, we saw that a lot of community members who were able to go and work were the frontline workers who are the most impacted, right? So we're seeing construction workers. We saw people working in some of the food industry that was still going on in the grocery stores. And these kind of provided kind of like the environment so that a lot of the community members started to be more exposed to COVID-19. On top of that, as a population, there's a lot of underlying health issues that that exist in our community. Not everyone has it, but obviously as a community, we have a lot of, hypertension or high blood pressure. We have a lot of instances of diabetes, which then increases not just the ability for your body to get COVID, but also in the way that it's responding. Folks tend to be sicker, and the sicker you are, and the longer you are, the more you're exposing others. We're also looking at the family unit, where a lot of our community members don't have the ability to isolate or really be at distance from each other. We're looking at multiple generations per household, and a lot of them, again, I'm not trying to overgeneralize everyone in the Hispanic community, Latinx community, but for the most part, we're looking at multi-generational homes with, multiple people sleeping in the same rooms, which makes it extremely hard. So I work in a grocery store and I am exposed to COVID-19, and I have to go home, and my mom and dad, my grandma's there, my little brother's there, maybe a cousin, I don't know. how do I isolate in a 3-person home where I share the room with my brother, right? So it becomes very difficult. And as a community, we are very community driven. What does that mean? From the beginning, we are very much a social community. We, big family dinners, gatherings on the weekends for, like a cookout or, being in our family networks and going out with like the neighbors. And that's part of our culture. So now we're telling people, not only do you have to stay distant from each other, in many cases, you don't have a physical ability to do that. We're also telling people you have to go against what you've been doing the entire, since you've been alive, right? Which is building community among community. So those are a lot of the reasons why. Of course, I'm not even addressing the fact that a lot of Hispanic Latinx communities don't have health insurance. Undocumented people from the very beginning were like, whether this is going to affect me or not in the long run, am I going to be able to get services? And all that information was just mangled up. Nothing, was very clear until, people started realizing, okay, yeah, Hispanic Latinx people have this huge percentage. We need to start doing something. But at that point, it was already a little too late.
What in terms of thinking about some of these factors that you sort of discussed here, and in some of my past conversations with you, I wonder if you might kind of comment on what you think some like state policy proposals would kind of be needed here to improve in the combating of COVID in Latinx communities.
Yeah, so for one, and not just in several parts, right? First, the prevention portion. In order to be effective in preventing COVID-19, from what I know, I'm not a medical professional, so I'm just going to go ahead and say that now, right? But from what I understand, you have to be able to not only stay socially distant, you have to have the masks, you have to take all this personal protective equipment. No, first and foremost, the state policies that we've been advocating for is ensuring that every single employer, every single business has those mandates, and then we're doing what we can to provide those materials for the businesses and the employers, and then also doing some go beyond the mask mandate so that we're actually following up with people. I'm not trying to be punitive, but provide incentives so that people actually do it. Right? It's one thing to say you have to do it. It's another thing you have to do it, and here's some of the materials we can give you so that you now don't only have to worry about keeping up with your business. You also now you have to do this additional expense. So let's actually help people out through that. We also saw the mask mandate in some of the opinions of a lot of people a little late in the state, right? And there's some politics to play in that, and I understand it's in the election year. But these are the tools that we need to not only tell people you have to wear this and be provide incentives, but also do follow-up so people are actually doing it. Also, give people the tools they need, right? Not just for employers or for grocery stores, but like anyone out there, right? For our community as a whole. Do what you can to be able to provide those services across the board. Also, expand medical, access to health insurance and to health services. That includes Medicaid expansion. That includes talking about or doing partnerships with health professionals so that we're going out into community and doing these COVID-19 tests. We're doing these, community outreach works, obviously, with all the precautions that we need to take, but that's part of the prevention process, right? You can't expect people to, if we're telling them, if you feel sick or if you've been exposed, go get tested. We also have to tell them, it won't cost you. It won't go against you, and be very clear about it, right? Because even today, we still get a lot of questions about whether or not going to the hospital, get a COVID-19 test, or going somewhere to get a COVID-19 test, how much is that going to cost me? And if it doesn't cost me anything, is it going to go against me in the future? Public charge being a big question on that, right? So that's kind of policy-wise. Make it clear that this is available for anyone who is documented or undocumented, period, right? And it won't affect them. Another section when we were talking about policy is the communications and ensuring that people have what they need in order to go into the services. ensure that every business, or not every business, but every entity in government who's providing a service, who's working with community, who's giving some kind of information out there, has someone who not only speaks Spanish available, but have someone who speaks any language that people are coming in there, right? Having a phone line to translate something is not always the best, right? Especially when people can't go face to face, right? We need to ensure that every entity that's going to be working on this COVID-19 response is equipped to handle whoever comes in for that service. So ensuring that policy-wise, every single, not just state organization, but local entity who's receiving state funds has someone who can translate, who has someone who can speak Spanish. And then when we're talking about more the economic relief part, a lot of our community members have been left out of the COVID relief efforts, right? That means, they don't have access to unemployment insurance, which then forces them to go back into community and back into work. A lot of people have not received any kind of like the stimulus packages at the federal or state level. On top of that, we just have this massive lack of information about what services are available for people. And they've been so scattered, right? So Orange County has a rent relief program, other counties don't. But then we have people from Person County trying to get relief from Orange County. Let's just make programs that are statewide, that are seen and well distributed, and you inform the community members well about it. Because having mismatch of programs across the state only causes more confusion. But yeah.
A lot of great ideas. Thank you. Thank you for that. I wondered if you might say a word or two more about this point you made with respect to accessing healthcare and kind of some of the fear. I mean, we've all, seen in the news over the last several years that the administration has sought to change public charge rules, as you alluded to. And, to what extent do you think fear has played a part in people's maybe reluctance to either get tested, to get treatment, to engage in contact tracing? What are your thoughts there?
I can tell you from personal experience, it's been a huge, huge issue in our community. When this first started, I was one of the staff members who went out with the mobile health unit to help push people to take the test. And even from then, right, there was a stigma on, if I test positive, I can't go out because I don't have these benefits to be able to, or I can't stay home because I don't have these benefits to be able to pay for my family to stay, in their apartment or getting food. But also they were worried about going to organizations, even like us from El Centro, to get aid from them, because what if public charge affects them? And right before COVID-19 happened, we had this whole massive misinformation of what, what public charge was. We saw the public charge rule, we saw the controversy there. So not only is that not clear in our community, now we add this additional level of stress and then tell people, go get these tests, go get these things, they're free, you will be able to help you. But in the back of their mind, they're like, well, yes, I need this, but do I need it enough to then put in jeopardy my community or my family, right? So I know for sure that was something, because I myself was in conversations with people saying, hey, we have this free test here. We're going to be, we'll do a test for you if you want to get tested. The first response was like, no, well, I don't know. And when we have deep conversations, it comes down to whether they're afraid of the stigma that comes with being COVID-19 positive and how that affects their economic stability, or it comes down to, I can't afford it if you have to take any medical, you have to stay some time in the hospital or whatever, which at the very beginning that wasn't part of the COVID relief package, right? You still had to go see a doctor. The test itself was free, but the medical visit, depending on where you were or where you went, wasn't, and it wasn't super widely available. So now we have mobile drive-thrus. You can go to different areas. You can come in and you don't have to go through that process that we saw at the beginning. But still, that going through that process and getting that help even from us, right? So we'll pay or help you pay for the doctor visit, and you get the test for free. Even that was worrisome, right? And now we're looking at a couple months down the road with rent assistance, with utilities assistance, comes up every single time. right? When we're doing these applications, whether when we have partnerships with like Orange County or another county, the worry is like, if I receive these funds, is it gonna hurt me in the long run? So I would say public charge continues to this day be a huge hindrance to even people who are seeking help from nonprofits who have no federal ties, right? So that's where we're at, and we're trying to educate folks on it, and we're now looking at different, what can we do in this campaign season, knowing that everything else is coming down, knowing it's getting super polarized, knowing how, you know, in this last month of the campaign season, we believe it's gonna get, as far as the misinformation and the attacks on the Hispanic Latinx community, specifically the undocumented and immigrant communities, are gonna get worse. We're trying to mitigate all that, but at the same time providing some, you know, other information in a way that doesn't saturate our community to the point that they're just like, you know what, I'm done, just leave me alone.
Yeah.
I don't know if that makes any sense.
Yeah, no, that makes a lot of sense. Thank you. And I should probably mention, just for those who aren't familiar with the public charge rule, you know, this is an aspect of our immigration law that's been on the books for a long time. And it relates to folks who are going to need to become dependent on governmental aid to sort of, you know, live, right? And what we've seen is some policy changes around what would and would not trigger that. And of course, a lot of fear, as you mentioned, around, you know, when that provision would apply and accessing what services would trigger a public charge ground in admissibility or not. And I think, as you said earlier, right, accessing COVID treatment and tests in theory shouldn't have a public charge impact, right? But there's still a lot of concern over that, and you know, to what extent the government will stay true to its word on that remains to be seen. I wonder if you might, you know, kind of shifting gears a little bit, you talked a little bit at the beginning of your comments on this issue of like worker protection, right? And essential workers and working in places where maybe they're in real close contact with one another. And what do you see as like essential worker protections to kind of help mitigate the spread of COVID?
Yeah, so first and foremost, everyone who is working should have free access to whatever personal protective equipment they need. That's number one, right? Because if you're here to earn a paycheck, you should be able to do that without putting your health at risk, right? That's number one. But as far as like looking at it short term has been, and we made a partnership with Wake County and a couple of other counties to kind of come up with solutions and recommendations on what we can do at the, you know, at the private and public sectors to encourage more, you know, more of this PPE usage and adherence to CDC recommendations, as well as providing aid for the businesses to be able to do this work, right? Because again, we can't just say you need to give people all the masks without giving them either the ability to get it at a reduced cost or being able to help them with that while they're still worrying about, you know, I've had to reduce my business 50% because I can't, you know, have the number of people in my restaurant. So, I mean, it's taking all that into consideration. So with the partnership we've created, what we keep hearing, and we've had conversations with elected officials, we had conversations with not just business owners, but also people who are leading businesses. They may not own it, but they're like in the management roles. And then we've had conversations with community members who are in the construction area arena. They're in the farm workers and kind of hospitality and food industry. They've all told us, well, different people tell us what they need differently, but the workers keep telling us we need to be able to not only have the short-term protection, but talk about how do we increase our ability to get health insurance through our employer or health insurance somewhere else, right? How do we work with businesses so that if they can and they're in a space that they can provide, you know, workplace insurance and, you know, sick time off and free day and vacation or personal days, so that if someone needs to take some days off to quarantine, it's not going to affect their ability to pay rent, because that's another one, right? So if I am tested COVID positive, but I don't really have that many symptoms, maybe I was just a slight cough, the more days I take off of work without any sick leave or without any personal time off, not only am I losing those hours, but I'm putting my job at risk, right? At what point is my employer going to say, you know what, you've been home enough, just stay home, I'll hire someone else? Specifically now, right? So when there's so many people looking for work, right? So like that's another thing that we need to talk about. And then when we're talking at the state level, right, it's been having conversations with elected officials to recognize that our community members are those essential workers who are ensuring that North Carolina can continue to feed itself, right? Not just talking about the farm workers, not just talking about the people in the meat packaging press. We're talking about people who are working in the construction industry now, who are fixing roads, bridges, and building so that people can transit throughout the state. We're talking about folks who are in, a lot of members are in kitchens, are creating the meals that people go and pick up curbside, right? These are all our community members. So when we're talking to our elected officials, is really putting that, into real focus. But unfortunately, we've gotten a lot of kickback about, we are not worried or so much about anyone who's not a citizen, right? Because there's a solution that undocumented people don't pay taxes or residents don't pay taxes, which is just wrong, right? Absolutely wrong. But in all the conversations where we're talking about, whether it's at the state or federal level, when it comes to aid packages that are, being pushed through to help, people recover economically, our community is being left out completely. I had a conversation with not just the Speaker of the House, but also with the leader of the Senate. And the question was completely avoided when we were talking, like, well, what protections are you going to do for like farm workers and for undocumented people who are right now in the front lines who are being affected by COVID-19? Completely swiped the question. Just didn't want to bring any kind of proposals to the table, didn't want to even discuss it. And then when we talked about what are we going to be able to provide for families who've lost their jobs but would be working every day and now need assistance and are not citizens, their response was, go talk to the governor on that, have them reopen the state. I was like, this is not a productive conversation. When we're looking at COVID-19 and we're looking how it's affecting not just the Hispanic and Latinx community, but just communities of color, we need to be able to, one, ensure that we are understanding that systematic racism has put us in a place where we now see people of color being extremely affected by this. We need to look at the health disparities that existed prior to COVID that are now extremely highlighted with the disproportionate number of our community members, being impacted by COVID-19. And then we also need to look at our economy. Who's the ones who are ensuring that we continue to, stay afloat as a state, right? Who's the ones that are continuing to do what they need to so that the grocery stores have food, so that restaurants are able to provide meals for people. Let's really be, I'm not asking you to like have, millions and billions of dollars to give out to people for no reason. We're talking about these are folks who are really affected by this. Let's look at the humanity of people. Let's look at the situation and come up with resolutions rather than talking points.
Yeah, so good. Maybe in the last few minutes that we have here, I'll put the same question to you that I put to Sirine about, kind of connecting the dots for law students who are watching this. How can they get involved? How can they support your work? What can they do to kind of make a difference in this area?
Thank you for that, and I'll follow in the footsteps of Sirine. Volunteer or work with organizations who are doing this work with our community members directly. Ask them, what do you need us to do? And for example, we are and we're going to discuss this later, but we're going to have some volunteers from Duke helping us with applications for DACA, right? And we're talking about like finding questions or finding answers to different legal questions that I don't have the expertise to do, right? Which, passing those on to someone and saying, hey, you have understanding of the legal system, you can read this thing better than I can because it's complicated. And so public charge, does this affect them? Yes or no? How does this work? Can you do some research on that? Can you give me some more information that I can then use that to create materials that I can send out to community members? Because we understand that legal language to something that we can hand people every day, it's kind of like a little bit of a transition. And we can do that if we have the help from folks who are willing to do that research and that setting up for us. Also, a lot of organizations right now are still doing legal clinics because people still need legal advice. They still need help. So I would just say the same thing. Talk to organizations around you that are working with the Hispanic Latinx community, learn what they're doing. And then if you're interested in and buy into their mission and their work, volunteer with them.
Very good. Very good. Well, thank you again, Eliazar, for your time and your wisdom with us here. We're so grateful to have been able to learn from you. Before folks go, I would just say, as a kind of a plug for the next event on October 7th, the next speaker series will be on local elections. We'll hear from Stephanie Arteaga, Spencer Bloom, and it will be moderated by Professor Peck from the Sanford School of Public Policy. So for those who can kind of come back and check that out, we would greatly appreciate it. Again, thank you, Eliazar, and it's been a pleasure to talk to you, and I've enjoyed our time together.
No, thank you for having me. It's been great.
All right. Okay. Bye, y'all.